Everybody wants a quick fix for their back pain. A pill, a shot, even a surgery. But history shows us that quick fixes often backfire. Let me tell you a story. James was 50 when he developed back pain, intense stabbing, shooting back pain that traveled all the way down his leg to his foot. He could barely make it through a meeting at work. His doctor gave him a steroid injection, cortisone. At first it was a miracle and the pain melted away. But a few weeks later the pain came roaring back, even worse than before. So James got another shot, and then another and another. And each time the pain relief got shorter and shorter and shorter. Eventually he was scheduled for surgery, but the result was predictable. Even after the surgery, the pain returned. The quick fix turned into a long nightmare. This isn't new. In the 19th century, doctors treated everything from cough to headache with opium-laced tonics. If you watch movies about the Old West, you'll often hear a medication called laudanum discussed. Laudanum was just an opiate, was freely available, and used to treat everything. And it made people feel great for a little while. But dependency, hyperalgesia, and even overdose followed, making things far worse than they were in the beginning. What looked like magic was really a trap. This isn't an indictment of opiates. They actually have their place. But they're not the only tool to relieve pain, and they're usually not the best tool, at least for long-term pain relief. In pain medicine, we've seen the same results, whether it's opioids or shots or even surgery. What looks like a miracle cure in the beginning often turns out to be fairly underwhelming in the long term. We use these tools and we sell them as long-term fixes, but they're really just shortcuts that can create even bigger problems in the long run. Pain is complicated. It's not just a simple inflamed nerve or a torn disc. It's the interaction of your muscles, your joints, your nerves, and your brain. And that's why one-size-fits-all solutions usually don't last. A pill may mask symptoms, but it's not going to rebuild strength. A shot may reduce inflammation, but it's not going to fix the mechanics. A surgery may remove damaged tissue, but it doesn't restore normal movement. And here's the paradox. Even when a procedure works, like an ablation for an inflamed facet joint or a decompression surgery for a herniated disc, the real long-term success comes from what happens after the procedure. If you don't rebuild strength, preserve motion, and protect the spine, the problem is just going to recur. The hard work, which is the physical therapy, the lifestyle changes, the posture training, those are difficult. They take a lot of effort, and many people just skip right over them. These are the things that lock in the benefit. The procedure is the spark, but the hard work, that's the fuel. And this lesson extends beyond back pain. Our culture loves shortcuts, crash diets, shots to reduce weight, miracle supplements, instant success hacks. These all promise speed, but lasting results come from hard work and effort, not from the quick fix alone. Even AI is a temptation here. We want it to replace the hard work of understanding, but without discipline and context, it may create more problems than it solves. So if you're chasing a quick fix for your pain, be careful. Remember James. Relief that comes too easily often fades away. That's why I built Pain Optics, not for short-term solutions, but for lasting long-term results. Check it out in the link below.